Hello everyone, welcome back. My name is Dr. Vijay Bhatia. I'm a psychiatrist. Today we are going to talk about anxiety. We will take a case who comes to the clinic and complains of anxiety. How will you diagnose? What investigations will you do? How will you proceed with taking the history? So person comes to your clinic and complains that he is feeling anxious. How will you proceed? The first thing is you need to establish that does this person suffers from anxiety symptoms. Mixture of symptoms are common. Coexistent depression and anxiety being by far the most common. Effort should be made to decide which is the predominant syndrome. In the clinic, the person looks tense, is slightly shaking, his hands are not still, he is slightly restless, he is sitting on the edge, there is no eye contact, and you find that his speech has anxious tone. The question is, how will you proceed? What type? What is the diagnosis? What is the anxiety about? Is it depression? Is it some kind of anxiety? And if it is anxiety disorder, what type of anxiety disorder? Because each different type of anxiety disorder needs a different kind of management and treatment. In the first instance, try to establish, is it anxiety? For anxiety, we need to establish some general features of a person who is anxious. They have autonomic arousal symptoms like palpitations. They can feel their heart pounding, racing, accelerated. They will tell you, I can feel my heart. It is too much. They might complain of sweating, especially on their palms, their forehead, especially at night, have difficulty going to sleep. They may complain of trembling, shaking. We will talk about in more detail, is it in places or at all the time or sometime. They complain of dry mouth, as if they need some kind of water or some kind of thing in their mouth, and because of this dry mouth they are not able to find the right words or speak clearly. And this is not due to any medication or not due to dehydration. Other symptoms, they might complain that they are having difficulty breathing, as if they are choking, not enough oxygen. They might complain of chest pain or discomfort in the chest or nausea or some kind of abdominal distress. Some people complain there is like butterflies in the stomach or churning in the stomach. They might feel dizzy, as if they are going to fall down or the surrounding is moving. They might find some kinds of feelings of unreal. Objects are unreal. They don't look familiar. The place don't look familiar. Or they themselves feel distant or not really here, as if they are on a different planet or different place. There might be a fear of losing control, going crazy, of passing out. There might be fear of dying, as if threat is there. So out of all these symptoms, 4 symptoms is enough to diagnose for some kind of anxiety. So then we need to establish the severity of these symptoms. How disabling are these symptoms? Can the person function? Can the person do the daily routine? Washing, dressing, shopping, going out, meeting friends, going to work. And if they are not able to do any of this stuff, that guides us how severe are the symptoms. Then we need to establish the type of anxiety. For the type, the journal questions are: number 1 is it phobic anxiety? That means, is it located only to some places, certain objects, or certain specific things? In this one, the main and most common is agoraphobia. That means there is fear of open spaces, crowds, fear of entering shops, leaving home, traveling away from home, traveling on the bus, traveling on the train, traveling on the plane, flying. So these are specific phobias, but they are general enough to not leave home and do their normal routine, called agoraphobia. The other phobic anxiety can be social phobia. There is a fear of scrutiny in small groups, like if you go to the barber shop, you will have this fear that the person might be asking me some questions, feeling anxious. There might be few other people, or going to the surgery, or meeting on friends, or in a club or something, or going and eating out. So there is this fear, and the person might feel that I will feel embarrassed because of my anxiety and shaking. I might spill the water. There is more blushing. Their face goes red. Or another specific phobia is about specific objects and things like spiders, animals, darkness, thunder, flying, eating certain foods, and sight of blood or injury or even needles, fear of exposure to specific disease. The person might be thinking, I might be exposed to coronavirus. And so due to this fear, the person is not going out, not doing anything they would normally do. So there is extreme fear of this, disabling them to do the things. And this, by the way, is fear out of the context. It is not that dangerous, although I use the word here, coronavirus, which is a real threat, and all the countries are trying to protect themselves. But in the specific phobia, there is no real threat to the extent the person is perceiving and trying to avoid and counteract those things. So this is fear when the reality is different. Other types of anxiety disorder we need to rule out. Is it episodic? That means, is it panic attack? What is panic attack? It's a recurrent attack of severe anxiety, panic. It comes out of the blue. It is not restricted to any particular place, any particular situation, or any set of circumstances. It can happen anywhere, anytime, even when the person is on their own or traveling. It is extreme anxiety. There's a complete fight and flight response. Autonomic arousal is there. Palpitation, heart is pounding. The pulse is very high. Sweating is there. Person cannot think clearly. Person cannot focus. So it is for short period, maybe 20 minutes or something, but this comes out of the blue, and in between the person might be fairly stable. Then is the generalized anxiety. This is anxiety which is more persistent in time, persistent in place. It doesn't care where the person is. The person is tense all the time, most of the time, day and night, not restricted to in any place, or even strongly predominating in any particular environment circumstances. It is called free-floating anxiety. There is a continuous feeling of nervousness, some shakiness, some doom is going to happen. The other anxiety we have to differentiate is the mixed anxiety and depressive disorder, because if these anxiety symptoms are present for some time, the person will start feeling worthless, useless, not able to function, and not able to do the things that they would normally do. They feel they are getting clumsy, and that might put them in a place where they feel depressed in mood. They don't enjoy things. So we need to differentiate from the mixed anxiety and depression. Both anxiety and depression are present, but they are not severe enough to qualify for each diagnosis. However, if they do qualify for depression, that should be the primary diagnosis, as this, unless this is treated, depression is treated, anxiety normally doesn't go away. Other differential diagnoses of the anxiety disorders are obsessive compulsive disorder. This is much more clear, although the person is anxious and tense, but this is because they keep on getting repeated thoughts. These are their own thoughts, by the way, and these thoughts are distressing. They shouldn't be there, and person recognize them, but they can't help. And if the person have compulsions as well, like to count things, to keep on checking things, keep on washing hands, or keep on locking the door, so that can cause anxiety. So this should be quite evident from the beginning of the history. The other type of anxiety disorders we need to differentiate is the reaction to severe stress. So if the person has suffered a severe stress, like a car accident or something, obviously the person will be very anxious, and there will be adjustment disorders, which is again to some kind of bereavement. The loss might happen, or 1 month ago the person is still very anxious, very nervous, not able to cope without the loss. And reaction to severe stress and adjustment disorders need to be separated. Is it the acute stress reaction within minutes, within hours, and it should last only for less than a week? Post-traumatic stress disorder, this person has suffered a severe stress of a nature and degree where anybody in that situation would have suffered some kind of anxiety and some kind of trauma and the after effects of this. And when the person comes out of this, months later, the person is suffering from flashbacks, as if living the same scene, same place, same scenario, having visual images of the place and the trauma and the suffering he has suffered. The other one is adjustment disorder. In this one, normally there is a bereavement and there is a loss of a very loved person or pet, and the person cannot cope without that, and they may suffer anxiety, feeling palpitations, as if they will not be able to survive without the loss. Or there might be work loss, the financial loss, or there might be loss of the partner, and they are not able to cope after that. So that will be adjustment disorder, but they all present with anxiety symptoms, as we discussed above, and need to be differentiated from anxiety disorders. What will be the mental state when we look at the patient? Appearance and behavior, as we discussed in the beginning, they will look tense. They are probably shaking, their hands are not still. When they're picking up a glass of water, they might probably spill the water. They have poor eye contact. There is no smiles, they are sitting on the edge. Their speech has anxious tone, and they might stutter or find difficult to find the right words. Their mood, they will tell anxious, but when we look at them, they do look anxious, they look tense. If you touch them, their muscles are as if they are very tense. They might be sweating. Touch on their forehead, look at their palms, they are sweating. Their thoughts, they worry too much, worry about literally everything, but if it is specific phobia, they will worry only about that thing, like for example for spiders or going to the crowded place, depending on their anxiety about that thing. They might be preoccupied with the worry, especially in the generalized anxiety disorder. Perception, normally they might have some kind of illusions. They perceive something, they see something as if that is a scary thing. If there is like a small speck on the floor, they might think it is a spider, because if they suffer from spider phobia, they will be looking and imagining things which look like the phobic object. However, they do not suffer hallucination. They are normally oriented to time, place, and person. However, they often describe that their attention and concentration is not very good, probably because of the anxiety and probably underlying some kind of depression as well. The insight is normally variable. They do understand that they have this fear, which is not real, but to them, the symptoms they produce is too much to deal with. And sometimes what happens, the person actually doesn't have to be in that situation or place, or they simply have to think about in their mind, and that will generate all the autonomic arousal symptoms and causing them disturbance, causing the anxiety symptoms. So we need to do some investigations, rule out any underlying organic cause by doing the routine blood tests like full blood count, urea electrolytes, kidney functions, liver functions, thyroid functions. Thyroid function, if the person is suffering from hyperthyroid, they will suffer from anxiety. If the person is drinking too much alcohol and then having withdrawal symptoms, there will be anxiety symptoms, and that applies to any illicit drugs, including amphetamines, cocaine, morphine, and other drugs. And calcium imbalance is important because hyperparathyroidism can cause anxiety symptoms. And ECG need to be done because it's well known that mitral regurgitation is a factor for anxiety disorders up to 20% of patients. And try to take the informant history. The management will depend on the severity of the symptoms, the type of the phobia or type of the anxiety. Is it panic disorder, anxiety disorder, panic disorder with agoraphobia? So all this will depend on the type of the anxiety and the severity of the symptoms, then the disability they cause to the person, and mainly the treatment is psychological therapy, especially counseling or cognitive behavior therapy, or in PTSD, EMDR therapy. And if the symptoms are very disabling and also accompanied with some kind of depressive mood or suicidal thoughts or self-harming behavior, then they would require specialist psychiatric mental health support and further diagnosis and management with the medications and treatment with the specialist psychologist and psychotherapist. Thank you for watching this video. If you like this video, please press the like button, share with your friends, and subscribe the channel. I see you in my other videos.